Bismillah ar-Rahman ar-Rahim. Welcome my dear students. My name is Dr. Ahmed Hagras. Today our lecture is about endocrinal axis and menstrual cycle. Introduction. Typically a woman of childbearing age or reproductive age which ranges from age of 15 to 45 years old should menstruate every month or every 28 days unless she is pregnant or moving into menopause. But numerous things get wrong with the normal menstruation. This menstrual cycle is essentially for production of eggs and for the preparation of the uterus to get pregnant. Definition of menstruation or other synonyms like menstrual bleeding, menses or period. It is cyclic uterine bleeding caused by shedding of progestational endometrium which occurs from the age of menarche till menopause, or as Novak says, it is tears of disappointed pregnancy. Characters of normal menstruation. Age of menarche or first day of menstruation. It is ranging from age of 10 to 16 years old, ranges from average 13 years old. Duration from 2 to 7 days. Less than 2 days it is hypomenorrhea, and more than 7 days it is menorrhagia. Number 3, for amount, it is from 30 to 80 milli. Use 3 napkins as average per day. More than 80 milli it is menorrhagia, and less than 30 milli it is hypomenorrhea. Several factors such as hereditary, diet and overall health can accelerate or delay menstruation. Number 2, length variation between 8 to 20 days in women is considered as moderately irregular menstrual cycle. Number 4, normally menstruation doesn't coagulate due to the presence of fibrinolysin enzyme which is called the plasmine secreted by the endometrium, and if blood clots occur, it is indicator of heavy menstruation. Finally, menstrual bulimia, or which is called premenstrual tension syndrome. It is a syndrome of mild symptoms ranging from 7 to 10 days before menstruation and relieved once menstruation occurs. That occurs in some females. These syndromes include irritability, weeping, crisis, nervousness and nostalgia, sometimes vomiting, diarrhea and GIT upset. We ensure the female that it is due to ovulation. Now we will talk about hypothalamic-pituitary-ovarian axis. There are two main components of menstrual cycle: the changes that happen in the ovaries in response to pituitary hormones, which is called ovarian cycle, and the variations that occurs in the uterus, which is important to remember that both cycles work together simultaneously to produce menstrual cycle. Also, changes in the cervical mucus occurs during the course of menstruation. This diagram will show us the relation between the hypothalamus, pituitary and ovary, which is called hypothalamus-pituitary-ovarian axis. Hypothalamus produces gonadotrophic releasing hormones which will stimulate the pituitary to release gonadotrophic hormones which are FSH and LH, that will control the ovary which will produce estrogen and progesterone and control the menstruation in the uterus. Ovarian cycle. Ovarian cycle refers to periodic changes that occurs in the ovary every month during female of reproductive period. Cyclic changes in the ovary occurs in response to two anterior pituitary hormones, FSH and LH, follicular stimulating hormone and luteinizing. Ovarian follicular development. The primary follicles or primary oocytes at the age of fetus, when this baby is in uterus, 6 to 7 million primary oocytes in 20 weeks gestational age. This number is reduced at the period of birth to 1 to 2 million of primary oocytes, which is much reduced at the time of puberty to be 300,000, leading to 400 to 500 menstrual cycles during all reproductive period. At the age of menopause it is very rare. These changes which are occurring in the ovary during each cycle are divided into 3 phases: follicular phase, ovulatory phase and luteal phase. Follicular phase from day 1 to 13, ovulatory phase from day 13 to 15, and luteal phase from day 15 to 28 days. Follicular phase from day 1 to 13. At the beginning of each menstrual cycle, the hypothalamus secretes gonadotrophic releasing hormone in pulsatile manner to stimulate the anterior pituitary gland to secrete FSH and LH, which are gonadotrophic hormones. FSH is responsible for the growth of primary oocyte to mature Gavian follicle, and this mature Gavian follicle is the responsible for production of the ovum. The follicular phase is controlled by the effect of FSH. Once the follicle grows to mature Gavian follicle, it leads to secretion of estrogen. This estrogen has negative feedback inhibition on the pituitary to stop FSH. Estrogen also causes the uterine lining or endometrium to be more thick. Ovulatory phase, which ranges from day 13 to day 15. The estrogen peak stimulates the secretion of LH, luteinizing hormone, which leads to the follicle to burst open, releasing the mature ovum into the abdominal cavity, or the process which is called ovulation, and corpus luteum is formed. Ovulation occurs on day 14 of 28-day cycle. We should notice that high estrogen also suppress FSH secretion, so no further follicular growth. Luteal phase from day 16 to day 28. After ovulation, LH level remain elevated and cause the remnant of the follicle to develop into yellow body, which is called corpus luteum. In addition to production of estrogen, the corpus luteum secretes a hormone which is called estrogen. And when progesterone reaches to high level, it will inhibit LH secretion, and this leads to degeneration of corpus luteum if fertilization doesn't occur. And so estrogen and progesterone drop and separation of the endometrium occur. Finally, menstruation and stimulation of hypothalamus to secrete more gonadotrophic hormone as the new cycle will start. This diagram will show us menstrual phase, then follicular phase, and ovulatory phase, finally luteal phase. Uterine cycle. This uterine cycle occurs in corresponding to the ovarian cycle, and these are changes. Refers to the changes are found in the uterine lining in the endometrium. These changes come about in response to ovarian hormones, estrogen and progesterone. There are 4 phases of the uterine cycle: menstrual phase, proliferative phase, secretory phase, and ischemic. Menstrual phase from day 1 of menstruation is marked by the onset of menstruation during the menstrual phase of the uterine cycle. The uterine lining is shaded because of low level of progesterone and estrogen. At the same time, a follicle is the beginning, develop and start producing menstrual phase end. When menstrual period stops on approximately day 5, so its duration is from day 1 to day 5. Number 2, proliferative phase. Proliferative phase, when estrogen level are high enough, the endometrium begins to generate. Estrogen stimulate blood vessels to develop, and blood vessels in turn bring nutrition and oxygen to the uterine lining, and it begins to become more and more thick. The proliferative phase ends when ovulation occurs on day 14. Secretory phase. After ovulation, the corpus luteum begins to produce progesterone. This hormone causes the uterine lining to become rich in nutrition and preparation for pregnancy. Estrogen level also remains high, so that the lining endometrium is maintained thick. If pregnancy doesn't occur, the corpus luteum gradually degenerates and the woman enters into the ischemic phase of the menstrual. Ischemic phase from day 27 to day 28, estrogen and progesterone level are decreased and corpus luteum is generated. Without these hormones to maintain the blood vessels network, and the uterine lining becomes ischemic. When lining starts down, woman has full cycle in once day 1 of menstrual cycle. This diagram will show us the thickness of endometrium. Premenstrual, high thickness. At time of menstruation, it is thinner and thinner. Then, at post-menstrual, it becomes more thick. Then it will reach to the maximum during ovulation. So, we have said Last cycle, we said changes in the cervical mucus that occurs over the course of menstrual cycle. Some women use these characters to help determine when ovulation occurs. During the menstrual phase, the cervix doesn't produce mucus. As proliferative phase begins, the cervix begins to produce tacky, crumbly type of mucus that's yellow. As the time of ovulation becomes near, the mucus becomes progressive, more clear, thin, lubricative, with the properties of raw egg white. At the peak of fertility, during ovulation, the mucus becomes stretchable, which is called sperm K positive. After ovulation, the mucus becomes scanty, thick, and this diagram will show us all the phases, follicular phase and luteal phase. And this also will show us the sequelae of the hypothalamic-pituitary-ovarian axis. Hypothalamus secretes gonadotrophic releasing hormone, which will stimulate the anterior pituitary to secrete LH and FSH, that will stimulate the Gavian follicle to be mature Gavian follicle, will lead to release of estrogen from the ovary. High estrogen will inhibit FSH secretion and stimulate LH production. LH make mature Gavian follicle burst and ovulation occurs on day 14. LH makes corpus luteum secrete progesterone. Progesterone inhibit LH secretion, and decreased LH and FSH level leads to corpus luteum atrophy if the patient is not pregnant and stop making progesterone. Decreased estrogen and progesterone level will stimulate GnRH secretion and menstruation occurs. And this is an example for some cycle abnormalities: anovulation, hypomenorrhea, menorrhagia, oligomenorrhea, amenorrhea, and finally, thank you.